Hi, ladies and gentlemen. It's Dr. Julio Novoa. I was asked to give my opinion on why I promote awake breast augmentation as compared to IV sedation or general anesthesia. And the main reason, well, there's a bunch of reasons. Number one, if you're going to have a breast augmentation, the absolute fastest, easiest, and safest way to do a breast augmentation is as an awake procedure. Now, no matter what your doctor will tell you, this is the fundamental point. Awake breast augmentation is done for the benefit of the patient. General anesthesia breast augmentation is done for the benefit of the doctor. All right? Because the only real benefit to doing a procedure under general anesthesia is if it's going to be of a benefit for the doctor. The majority of times, you're going to get some other reason as to why general anesthesia is done the way that it's done. Now, I can understand that there's going to be a certain percentage of patients that do not want to get a breast augmentation done fully conscious. They're just concerned that they're going to have some anxiety about it or concern related to pain. But let me make it clear. Awake breast augmentation is practically painless. Minor discomfort related to it as you're getting the anesthetic and occasional nipple discomfort or nipple shock related to creating the pocket. If you've ever gotten a tattoo, even the smallest tattoo that you've gotten has probably produced more discomfort than an awake breast augmentation. So if we can address the fact on how the discomfort level of an awake breast augmentation would be, let's put that aside for a moment, and we put aside the other issues of safety and ease and related to breast augmentation. What is the fundamental benefit to doing a procedure as an awake breast augmentation? That is the ability of the patient to make the final decision on what breast size she wants to be, the final decision. Okay, because if you leave it up to the doctor to decide, there's going to be some inherent either financial incentives, conflicts of interest, or biased, the personal bias of the doctor. Now, they may not think that a patient should be that small or should be that large. They're making a decision that's going to affect the way that you look for the rest of your life. Now, it's a different story if you're asking a patient about how much liposuction to do. Most patients would agree that I want to have as much fat removed as possible, okay? But a similar question might be a Brazilian butt lift. How big do you want your buttocks to be from fat transfer? Now, that should be left up to the patient and not make it as big as possible, and that's another benefit to awake procedures. But what I see happen so many times is this. A patient will be told by her doctor that she can be a certain breast size. And then, lo and behold, after the surgery, there's always some ridiculous reason as to why the doctor was not able to do what the patient wanted. All right. Most of the time, and I've not seen it happen before where they actually go too big. It's always that they go 1 or 2 cup size smaller, and the patient is disappointed. If you're going to invest $5,000 to $15,000 on a breast augmentation, don't you think it would be in your best interest, or be something that you would probably want to do, is make the final decision on how large your breast augmentation would be? The benefit to awake breast augmentation is not only that you're able to do that you have that power, you have that informed consent, the moment from the surgery, but that you're actually allowed to have someone come into the room and help you make a decision on your final size. That's not left up to the doctor. That's not left up to someone that's not you, that's not part of your family, that's not going to see you every day. Someone that's probably going to see you maybe a few times, and then maybe once a year, or maybe never again. So the decision making as far as how big your breast should be definitely should be left up to you. And that is the benefit to awake breast augmentation, because you really can't leave it up to the doctor because of the financial conflicts of interest and the inherent even personal biases or social biases that the doctor may have, and maybe subconsciously just hey, I don't think that you would look good as a 500cc. Well, that shouldn't be left up to the doctor. It should be left up to you. And that is the benefit to awake breast augmentation, where you're able to make that decision before the closure of your implant, from your incisions, the closure. And you can actually physically see what you look like with the mirrors placed in front of you and placed to the side of you. I get the same comments so many times, weekly actually, where a patient will send me an email and say, you know what, I thought that the doctor promised me or told me that I could be a double D, and he only made me or she only made me a C. And most of the time it's going to be a he, because most of the plastic surgeons that I know of are male plastic surgeons. So it's always an inherent issue of misogynistic tendencies as well. So if you're going to have a breast augmentation, my key point is to tell you is this. If you can have the procedure done under general anesthesia, you can absolutely have it done as an awake procedure for a breast augmentation by itself. That's the key point here. And if you hear otherwise, it's just that that doctor does not know how to do an awake breast augmentation. Now, mind you, it has to be done in the technique that we're talking about, not by the technique done as something called super wet by the plastic surgeons, which are commonly done with liposuction. It has to be done in the technique of Dr. Anil Gandhi, his awake breast augmentation technique. I've done more than 3,000 of these breast augmentations, and I have, in more than 3,000 operations, I've only had 2 patients that thought that they went too big. Almost all of them said that they probably could have gone a little bit bigger. But the fundamental point is that decision was not left up to me. That decision was left up to every single one of my patients, which is the way it should be, and not left as a surprise after the patient wakes up from her surgery. You don't want a surprise like that and not be and end up being disappointed because the doctor promised you something that you were expecting and you didn't get what you paid for. Keep that in mind. Thanks so much for watching. Take care.